I'm going to tell you how to approach the history taking station in an OSCE exam. This applies to the classical history taking station, in which you have a simulator or a patient and you're asking questions in the presence of the examiner, or in situations where you are just asked to write out the history. The mistake many candidates make is that they just cram all the questions relating to anterior neck swelling, relating to abdominal pain, relating to groin swelling, and you just want to reel out all those questions. It doesn't work like that. Sometimes it may work to some extent when you have the examiner listening, because the examiner is not going to be fishing out or picking out the important aspects of the questions you're asking. It's not supposed to be so. You're supposed to have salient questions. I give you an example, starting from the biodata. You want to be asking name, age, sex, tribe, religion. No, now why? In the history taking part of the OSCE, there is a checklist, and in the checklist you don't have scores for biodata. What you have scores for is a candidate comes in, greets the examiner, greets the patient. They are supposed to ask, you can ask for the name and the age. That's if the age has not been mentioned in the question. The name and the age are sufficient. Don't start asking for their address in an OSCE exam. You won't get marks for it, and it's useless. You then ask about the presenting complaint. They would have given you the presenting complaints in the question, so you don't have to be asking, why are you here? What's your presenting complaint? No, you go straight into the history of what you've been told is the problem. Whether you are, if you are writing it down like that, you will not say presenting complaint, anterior neck swelling. You won't get any marks for that, because they've already told you that the patient has an anterior neck swelling. So you should go straight into the details of the anterior neck swelling. Now, the way to think about it is this, and it's the same way it applies in real life. When you are taking a history from a patient, you should be able to classify those symptoms in a way. There are compression symptoms, right, for an anterior neck swelling. There are symptoms of hypothyroidism. There are symptoms of hyperthyroidism. They are the ones that have to do with the dietary symptoms. They are the ones that have to do with nutrition. They are the ones that have to do with whether it's familial. All you need to do is to ask 2 questions under each area. You don't need to ask 6 questions. For example, you want to know if this is a toxic goiter, and you mention palpitations and tremors. That's enough. You don't have to start going through the systems one after the other, talking about hyperdefecation, talking about excessive sweating, talking about easy fatigability, you are just wasting your time. You're not going to get extra marks for that. So it's the salient parts of the history in those areas. Once you pick those areas, you have got your marks. And then you go into a review of systems. When you talk about review of systems, it means that for the chest, you are just asking 1 or 2 questions so that the examiner will know, oh yes, he's thinking in the right direction. The abdomen is thinking in the right direction. And if you do it like that, you find out that within a short period you have finished it. Your past medical history is very important. So you want to ask about diabetes and hypertension. You don't have to say you want to know whether do you have ulcer? Do you have sickle cell disease? Do you have now? You are not going to get extra marks for all that in a history station. So it is the essential things you ask. Then you go on. If you want to talk about previous surgeries, let it just be there, previous surgeries, and that's the end of it. History is over. Drugs and allergies. 1 or 2 questions. The whole thing is over. But the problem is that most of you want to write so many things or ask all the questions, and then you will not finish. And you must always remember to say thank you to the examiner and the patient after. So it's quite straightforward, quite simple. But I know sometimes if you don't have the heads up about how to answer these questions, it may look like it's complicated. All right, catch you in the next video.